reproductive freedom affects us all, affects society, affects the systemic and institutionalized structures within society. And upon answering this question, I couldn't help but find myself in like a deeply contemplative space and connecting reproductive freedom to humans, whether it be women or non-binary, gender non-conforming, trans folks, anybody, but specifically women, because I am a woman, so I can only speak for myself. Connecting this dynamic, connecting reproductive freedom. Woo! Spiderweb. Just kidding. Couldn't help but connect it to and relate it to the integral nature of the spine within the human body. And as I was thinking of reproductive freedom and what it brings to individuals, to communities, to society, whether it be on a micro or a macro level, the song in the tune of Rising Appalachia, but the song by Maven Morris, Bones, kept coming into my awareness. The house don't fall when the bones are good. The paint can crack, the windows could shatter, something like that. Essentially saying that like the bones are that which upholds the house, right? That the bones are that which provides the structure and the support, allows the vessel to remain in an upright position. And I couldn't help but think about how this is reproductive freedom to society, especially to everything, to individuals on a micro level, but to society at large on a macro level. Because when people have the ability and the freedom to make choices regarding their own reproductive health, whether that be having the resources and the options to go to fertility clinics, whether that be women going and seeing special women's healthcare doctors to get the care they need to balance their hormones and to improve and to take care and to treat their own fertility, which is not something that's covered by most insurance. This is something that usually women have to pay out of pocket for. I feel like, at least for most insurance companies that I've been aware of, they don't cover anything fertility related. At least on my side of the rock here on the West Coast. It's something I've noticed, at least in Oregon and in the counties that I have resided in. But the same can go for those who realize they don't want children, for whatever reasons that may be. If someone decides, oh, I don't want to bring children into this world, for whatever reason, whatever it may be, whether it's because I don't have the financial resources or because I don't have the emotional, the physical, the mental capacity to do so, or just because I simply have free will and I don't want to do it. Oftentimes, even those types of decisions are not covered under healthcare. The paths that one must travel in order to honor those decisions, whether it be tubal litigations, or is that the right term? I think so. Getting your tubes tied, or whatever it might be for men, getting your testes snipped or whatever, in order to prevent offspring from flourishing. These types of choices are not able to be made freely, and often the lack of reproductive freedom leads to many situations that are not healthy for society and for individuals. When humans don't have the resources and the options to go get the reproductive health care that they want or that they need, they often travel down paths that were not ideal outcomes for themselves, which just leads to greater disharmony and imbalance in the world. Because what is freedom? Freedom is the ability to live life on our terms and to be as sovereign as we desire to be. And I just thought it was a really beautiful way to connect reproductive freedom to some real life, like practical relationships. Also, just to add a little bit more clarity and context to what exactly happens, how do manifestations present, or what are the symptoms of a society where reproductive freedom is not honored, whether it be humans not having the support that they need to have healthy and balanced maternal journeys, or whether it be people being forced or coerced into having and or keeping babies who didn't necessarily want them in the first place. What happens? How does this manifest in society? And I can't help but think about what happens when, let's say, a woman who either did not have the resources, whether it be financial resources or whether it be just like the bodily resources, the mental, emotional, physical resources to go through with this. What happens to a woman, to her family, to a community, to the baby when they are forced to endure this journey without the proper nourishment and support? And the way that we see this manifest is mothers get burnt out. Those on this journey get burnt out. And what does burnout lead to? Burnout leads to unideal, usually negative mental health outcomes and physical health outcomes, right? If we think about what happens to doctors when they experience burnout, their patients suffer, their practice suffers, the hospitals they work in suffer, because the doctors, and I think it's really wise to think of people going through this journey of maternity as doctors as well, because ultimately mothers know best, right? And if a woman knows she doesn't want to be a mother because she doesn't have the capacity to do it, yet she's forced into it, and then travels down this path of burnout and experiences negative health outcomes and all kinds of different implications, not only does she suffer, but her family suffers in relation, and to the growing offspring. Whoop, now we're going downhill. The growing offspring suffers as well. And whatever that might look like, however that might manifest, it's usually in the form of certain health conditions or diseases or the psychological conditions or implications come into play. If a woman wants to have a child but doesn't have the fertility care necessary, the hormonal support, the doctors to help balance her hormones, to ensure that she is experiencing optimal health while traveling this journey, negative health implications arise, or health implications arise. And then on the flip side, what happens when someone, oh, maybe that was the flip side. What did I just talk? I think what I said originally was what happens when someone doesn't want to become a mother because lack of resources or just simply free will. But then on the other side, if someone does want to become a mother, but that reproductive freedom is not supported through proper health care options, which are often supported by adequate legislation, governmental support, state and federal-wide support, the same things happen. Negative health outcomes for mom, for mama, for baby, essentially affecting the entire fabric of our society. Because what happens when society creates conditions where negative health outcomes arise? Nothing too good. Ultimately, it is what it is, but what good is a society that is intentionally and willfully and consciously creating conditions where reproductive health is actually not reproductive health, it's more like reproductive unhealth, reproductive illness, right? What is the opposite of reproductive health? If it were truly reproductive health, there would be legislation to support adequate healthcare options for all beings who want to procreate or not procreate. So what is the opposite of that? If it's not reproductive health, then it's reproductive illness. Healthy humans, healthy social structures support the expansion of healthy communities by creating healthy individuals that create healthy societies worldwide. It's all connected. It's all connected. We are all connected. Okay, I'm good.